Hi, everyone. It's Emily here today on the podcast, and I have an extra special mom guest person here with me today, Alessandra McLean. You're so special to me because you were in my mom survival guide group, and I just love you so much. And we both live in Charlestown. Actually, we should really just go through. You're like a nap super fan, also, I feel like. You've come to pre-baby boot camp. You did a pregnant mom survival group when you were pregnant with Nicole. We're going to talk about lactation today. You met with me through our MSG group. And then dare I say you're enrolled in a working MSG now?
Yep, it just kicked off last night with Alan.
I absolutely
Yep,
love it.
so I'm a frequent flyer.
You're a frequent flyer,
Absolutely.
and I love it.
Punch my card.
I know. And it's so great for me because I get to run into around town now and see your daughter, Caroline. How old is Caroline now? Tell everybody who's listening.
Yes, she'll be 7 months next week.
That's crazy. She's just a little bit behind Eloise, I always think, because Eloise is going to be a year next month, which is crazy.
Yes, I love to see everything you're doing with Eloise because I say to myself, okay, in another month or two, Caroline will be doing that. Okay, great. This is really great to track a gift.
Exactly. Yeah. And I like how you said another month or two because we need that big time because every baby does it differently.
You need the range.
You know, like kind of what's
fixated on the milestones.
It's in the horizon. So, okay, everyone. So we're here today. I really wanted to talk to Alessandra about lactation. Like, I think you have a really cool story of how you got started and you worked with us for lactation, and we got to talking on the side about how a lot of people out there don't really know what your options are in this area when you have a baby and when you're pregnant, especially like what you can do through naps. So we're going to share your story with people and talk about this kind of stuff. I think back to when you were in Nicole's pregnant mom survival group. So everyone listening, that was a group that met once a month for about 5 months when you were pregnant to make other connections with moms. And I remember you saying to us here at NAPS that Nicole unintentionally gave this warning about the hospital and was sort of like, it can feel very overwhelming in the hospital after you give birth because you have pediatricians coming in, you have nurses coming in, you have lactation consultants coming in. There's a lot of people that come in the room and they all have, we all practice evidence-based care and have advice that's often in line, but style is really different. And that and how you teach something to a patient can vary, and that can be really overwhelming. So I wanted to ask you, I know you had that warning from Nicole, but I know you've mentioned that you still felt it. What was it like for you in the hospital when you had Caroline?
Yes, absolutely. So I delivered at Brigham and Women's where I had an amazing experience. I was fortunate enough to actually have my OB deliver our baby too, which I feel like never happened. So that was super exciting. She was actually about to go on vacation. I was like, come have a baby with me Monday night. And it literally happened. But awesome. In the postpartum aspect of it, you're so right, Emily. It's a revolving door of people. Not to mention your body has just gone through a lot. You are healing in all sorts of ways. And as much as I'm an organized person trying to take notes, there are all these different lactation consultants that come through. And I can honestly say I saw 3 during my stay. They all may as well have just shared completely different information. I feel like they did each give a little bit of a different strategy. Some of their styles gelled with me. Some of them did not. But all the while, I had the confidence that I knew I was setting up a lactation consult with NAPS for shortly after I was getting home from the hospital. So I said, okay, I'm going to take their feedback as a grain of salt, but I know I'm going to have an amazing trusted resource coming into my home once I'm in the groove here, once I get home. So it was great to hear their perspective, but I knew that I was going to have, and I did request Nicole because I bonded with her in our expectant moms group. That were all February due dates. So I knew I was going to have somebody that I felt comfortable with, was medically backed also, which I really loved. Mm-hmm. So I knew I was going to have her come in, and that was just such a great thing to be pacing towards when I got home.
Yeah. I mean, I feel like I'm making the assumption that you had some of that inner education through boot camp and through Nicole's group, that not just that you might feel overwhelmed, but it was ingrained in you somewhere along the line that it's normal to need help when you're breastfeeding and when you're not just feeding your baby. So when you were flooded with all that information, you had that ability to kind of probably tuck in your head, like, it's okay because I'm going to have one sounding board come in. But I think about even knowing that, how that must have felt in that space. Because when I had Eloise, and I was breastfeeding, I do this for a living. And I still felt like a deer in headlights at times when I was postpartum because I was tired and I was bleeding and I was actually pretty uncomfortable after my third vaginal delivery. Like my tear, was more uncomfortable than I don't remember that with my first two. And so I do recall like asking some breastfeeding advice when I was there and feeling a little overwhelmed by sometimes some of the answers that I got. And it made me be like, geez, like how do other people feel if this is how I feel?
Yes, absolutely. And I think the biggest thing for me in both pre-baby boot camp and the expectant moms group was book a lactation consult even if you're not having like an issue. Like it was just something normal to do, which I so
Right.
appreciated. So I knew I was going to try breastfeeding, see how it goes. And I think the common misconception is you shouldn't book it until you're having issues. You're having issues with a latch, you know, have an infection, your nipples are sore, like whatever it is, that like that should be the impetus to book it. But I
Right.
went at it from the angle of I'm going to book this regardless because I want the best practices. I want the tools to know how to
Hmm.
do this best. And the name of the game with being a new mom is like the advice from a trusted resource and the reassurance. That's my biggest thing. I feel like
Yeah.
constantly, you know, I post on your board all the things, and I just need that reassurance sometimes from a trusted resource. And there's just so much noise out there, and I think where naps has just so come in for me is, as you can see how I'm such a frequent flyer, you have become my one-stop shop, and that is so helpful to me, so I don't need to go down rabbit holes and look into other services and things of that nature because I know I can come to naps for everything I could ever need. And I think that's the biggest thing for me. But it was just so helpful to have that booked, even if I was like, I left the hospital feeling like I had a good latch, and I left the hospital feeling like I
Well,
could kind of do it.
I did want to ask you because I
Yeah.
obviously wasn't there.
Yeah.
I do think a lot of moms who are pregnant or expecting a baby listen to women. We're trying to have open and honest conversations about breastfeeding and feeding your baby and pumping and bottle feeding and how it can be hard. And I'm working very hard. I don't want people to hear things and think like, this sounds really scary. Like everyone says it's hard. Let's like talk about what happened in the hospital. Like, do you
Yeah.
remember even was it pain? Was it logistical, like physical, like it was painful? You just said you felt like you had a good latch. Was it more that you just had all these questions about newborn care? Like, do you remember in that moment where you were like, I need a lactation visit because X, Y, and Z is happening? Like, how was
Yes.
the start for you? Like, what was going
Yeah.
on?
Yes, absolutely. So I knew I was going to try to breastfeed. So in the hospital, the way it worked was they said, okay, if you're going to try to breastfeed, we're going to essentially bring this baby to you constantly, you know, every 2 to 3 hours to instill the latch and put her on. And, you know, I was fortunate that she came out like with like such a clear like suckling reflex, like knew right where to go, which is just like so amazing that a baby knows how to do that. So I was very fortunate that she was very good at that. My situation, and you know, this is where the lactation consultant came in so helpfully when Nicole came, I was having a low supply issue. So my situation was I after so one of the big things that happens during the lactation consult is that you will do a feed and then they weigh the baby after to
Mhm.
see how many ounces they consumed. I was having like showing literally not even an ounce after Caroline would feed, but she was like trying her darndest to get something out of it. And then there was, I
Right.
think, an element of it being like a soothing element as well. And we can definitely talk through like the actual things that happened during the lactation consult as well, but we got to do hospital first.
Yeah.
I know one of the big things at the hospital, like from a real world example perspective, I, similar to Emily, am a big sleeper. I knew that was going to be a big thing for me. And I had a plan ahead of time that even if I was going to breastfeed, one
Mhm.
of the overnight feeds was going to be done by my husband with a bottle. I needed to have a patch of
Right.
sleep for my sanity. So, one of the big things I wanted one of the lactation consultants in the hospital to teach me was how to use the pump. They straight up refused to show me how to do that. So that was something that I was like, thank God I have Nicole coming next week. She's going to show me how to use a pump. Thank God. And because they were like, well, if you're having a good latch, we need to keep doing this. We need to,
Right.
keep this going in the hospital. And I said, but I do want to learn because I am going to probably try to do that eventually.
Right.
So that was something that, again, I really rested on the fact that I knew I had somebody from NAPS coming down the road that was going to help me with that. So really, I mean, how it goes is they bring the baby to you constantly. If you're having a good latch,
When you
that's good.
say bring the
Yeah.
baby, let's clarify too, because
Yes.
some women have the baby in the room, in the
Yes.
crib, but the nurses are coming in and they're like, okay, it's time to feed, it's time to feed. Versus some babies are in the nursery, so they're bringing the baby into you. What was
Correct.
your experience?
Yes, that's a great clarifying point. So during the day, the
Where is
baby
it
was in.
coming from?
Yes, literally. During the day, the baby was in the bassinet in the room with us. So
Mhm.
that was like I went and got her, but because I had no idea what I was doing, I was having the nurse help me and show me every
Yeah,
single
you hit that
time.
call
I was
bell,
like,
like, get
am I
on in
doing this
here.
right? Bring your boppy to the hospital. I didn't. That was a colossal mistake because I feel like I was like stacking like 7 pillows to prop her. It was just the whole
Okay.
thing. So bring the boppy would also be a recommendation. Um, and then at night, we did take the hospital up in the nursery, sending Caroline there. Everybody we talked to recommended doing that. They kind of try to push back on doing that, but I pressed ahead and advocated for myself and said, I need to get some rest. Bring the
Mhm.
baby to me for every feeding cycle, but she can go to the nursery at night. Best decision. Highly recommend it. So they would be bringing her from the nursery overnight. But the joke is, you're feeding still every 2 to 3 hours. It's not like you're getting a full night's sleep. The baby goes to the nursery. Let's be clear. So definitely they would bring her in and kind of coach me through it every single time I would try to feed her. The nipple soreness is real, and I don't know if Nicole helped me with this, but like I feel like my baby had quite the clamp, so it
Yeah.
was hurtful at times. And I swore by like the nipple cream, and I swore by these little tin cups that I think I literally wore up until month 5 in
Yeah.
my bra. Like they
People
were
love
incredible.
those.
The sterling silver
Yep.
healing
That's true.
properties. I don't know what they do, but they do something amazing. And I literally started using those and
They
then never had to use
feel
cream
good
again.
too, like they're cool, they feel cool, like they feel
Cooling.
nice on the nipple and soothing, and they protect them from like that the bra like touching them, just like that buffer.
Yes, it makes them not raw anymore for some reason. Who knew? Miracle thing.
Yeah. So it sounds like you did have a little bit of nipple pain. You kind of knew what you were doing with the latch. You got a little mixed information. The baby's coming in and out. And at that point, you're like, I'm going to have Nicole come.
Yes. I mean,
Like,
I going into the hospital knew I was going to have Nicole come regardless, to be honest. But after that experience where I felt like I was just getting information from all angles at a time when I probably did not have complete mental clarity, it was
right.
even more a decision for me.
So I almost want to clarify too for people listening as a provider, like why would you get mixed information? Because I worked in the hospital for over 10 years. I work in the home with patients all of the time. And I do think while it can be confusing as a parent on the other end, like why would a doctor tell me one thing and then another doctor tell me another thing? Or one nurse told me one thing and one nurse told me another. Yes, there is this element that there are people out there that practice their way, like it's their way or the highway. It's how they've learned, it's what they've taught. But overall, I would say most providers that I've worked with in the hospital, we are usually on the same page in terms of evidence based care and what's best for mom and baby. There is this layer of style and how things are changing all of the time, right? So I met with a nurse this morning who works in the hospital, and she sees the mom right away, and I see the mom 5 days out. And what she would tell the mom in that moment who is learning to latch and the milk supply isn't in is very different than what I'm going to tell that mom 5 days later when the milk is in and the latch feels and looks different, right? So there is this other angle that sometimes it's not what people are saying that's necessarily wrong. It's in that moment what might work. And then there's this other piece that yes, there is different ways of doing things, and we talk about this in boot camp. What one nurse told you was right, and the other nurse who told you something very very different also probably was right. And it's up to the parents to make the right decision for them. So it's on us to do a better job as providers to say, like, there's this path and there's this path, and they're both great choices. What feels good to you? And I think that's where what we're really missing in our healthcare system and really at NAPS, where, and we'll talk about Nicole's visit. My hope is that when our nurses come in and work with you, it's to not like shit on what went down at the hospital. It's to say, like, okay, like all of these things are moving around. These are the parts. What do you want to do? Like, you wanted to pump. So it's like, let's show you how to pump. Because and you want to sleep. And by the way, for everyone listening, like, yeah, me and Alessandra, we like sleeping. Sleep's great. But why do we want it right now when we're postpartum? It's because you said it's for my sanity. That's your mental health. Like, you and I both have talked about this. We're better people when we have a little bit of sleep. I'm less anxious. I'm less irritable. I'm a better mom. So, like, that's what we mean by we need sleep and we want sanity. Um, but so let's segue into that piece of this is like the NAPS nurse comes in. So Nicole came in. What went down at your visit with Nicole? Like, do you remember that first visit? Because there's a lot that
Yeah.
happens there.
Oh my gosh, it was like welcoming my best friend into the home, honestly, like a week into having a baby because we'd been on Zoom together for the 6 weeks leading up to our February due
No.
date. And it was just such an amazing reunion in a lot of ways. But so it was amazing that I knew her to begin with for sure. But
Right.
honestly, all of the NAPS nurses now, having met so many of you, I think any of them coming in would have been amazing. But it was great. She came in, she completely laid out for me what the visit was going to entail, kind of what we were going to plan to do. And then, she showed me all of the different, holds for breastfeeding that I could do. She
Mhm.
observed me breastfeeding, gave me modifications as we went through. She did the weighted feed. So we fed and then we weighed Caroline after to see how much she potentially consumed. And then what I absolutely loved was she gave me, a host of options and said, these are the paths forward, and you need to decide what's best for you. And I just so appreciate that she also would come at it from the medical side, but also the friend to friend side. She said, this
Mhm.
might be the right choice for you now while your baby is so little, but it might be a situation at month 4 when your baby is fighting breastfeeding because they're now more aware that you have a low supply, that you want to prioritize your time in spending with her, playing with her, going on walks
Mhm.
with her instead of, fighting your way through this breastfeeding if it's not really working for you. So I just so appreciated that she gave me amazing options. And then the follow up after, she would send me an email rundown afterward of everything we covered, which was so helpful. And then the other thing I would mention too is it didn't it didn't have to be just about lactation when she would come. We would actually troubleshoot a lot of new mom things. We would talk about sleeping, we would talk about
Mhm.
swaddling, what was working, how were naps going, all things like that. So I really just got so much out of every visit because we talked about a whole host of topics and it felt like my friend was just hanging out with me in Caroline's nursery. So
I
it was awesome.
know. She's just so lovely. I think you raise a good point that I'd love to talk about too for everybody listening is that and I'd love your obviously insight as a mom before you knew naps too is that it is my experience when I meet patients who didn't know us when they were pregnant that when they hear the word lactation consultation or I'm going to have a lactation visit that it's not only a visit that's only and all about breastfeeding but that to have a lactation nurse come, like to qualify for that visit or to pick up the phone and make the call, you need to have some kind of colossal shit show storm happening in your home. Like you call for lactation because something's really wrong.
Right. And that is absolutely not the case. And I set
Right.
it up, beforehand of, I would totally recommend as much as you can get your ducks in a row before you have the baby as well. So I had obviously heard about having a lactation consultant come through from pre-baby boot camp from Nicole's expectant mom MSG. So I think emailed if I could even do it, if I could make my appointment before I had the baby. And you guys were like, actually, you need to have the baby first.
We'll be here.
But
We'll be
yeah,
here. Just have the
we'll
baby.
be
We're
here.
not going anywhere.
No, and you can get somebody over to your house so quickly as well. So don't
Yeah.
worry about that. I feel like you do something grand with your scheduling system that you must prioritize new moms or something. But they were
It's
able
this
to.
lovely woman named Gabby who does the
Gabby,
schedule and
my
she just
girl,
yeah,
truly. Shout out to Gabby, the most responsive, amazing
I
person
know.
ever. I'm indebted to her as well.
She does
Um
deserve a massive shout out because we do hundreds of visits in a month and she is texting with those moms and navigating the schedule and her priority is to get people to be seen as quickly as possible. Because when you do have an issue, you need to be seen right away. Like
Yes.
when shit's not going well, you want to get that addressed right away. So there is this
Yes.
like dance, right?
Absolutely. And so the planner and me, wanted to get this lined up. So it was one last thing I didn't need to think about once I went in to have the baby. But Nicole told me that the sweet spot was like 7 to 10 days or so after you get home from the hospital. So I think we did it for like exactly a week after I got home. I remember I had like the email drafted in my inbox to just like then be able to send to Gabby to be like book it. So that's a little excessive. But I also too, in terms of like a planning perspective, this is something that is covered by a lot of insurances, which I was very pleasantly surprised to hear. So I also made a call to my insurance carrier about a month
Mhm.
before I was due to have the baby and said, to what extent are lactation in-home consultants covered? And my insurance covers them 100%. They reimburse you. You have to pay out of pocket initially, but they
Okay.
are covered at 100% and on an unlimited basis. So a lot of times it's like 6 visits or whatever. So that also just gave me such the freedom to know that I could book as many of these as I wanted, as long as I thought it would be helpful. So I
Yeah.
think we had Nicole come either 4 or 5 times in person. And then we also did 2 phone call follow ups after. So that's the
Yeah.
other option you have. You can do in person, but then you can do some like phone catch ups after the fact as well.
Yeah, I mean, I think for anybody listening, lactation, first of all, we can see people when they're pregnant. You can have a prenatal lactation visit and actually talk about what your feeding goals are and what is it going to look like and what should I expect in the hospital. To like you're home with that newborn and you want someone to come in and is my milk and is my baby eating? Is it working? Up to like I have moms that are going back to work or starting solids or their baby's sleeping through the night. And now they want to talk about breastfeeding or pumping as it relates down the road. I have moms that are combo feeding. They are breastfeeding and using formula and they're like, I'm done with pumping. How do I walk that dance? And this can go on for as long as you need it to, right? Like I'll see patients even a year out. But I do think that it's real. The big takeaway so far of this podcast, if people aren't noticing, is like the advocacy piece, right? You have to advocate in the hospital. You need to advocate for yourself for the care that you need, and you need to advocate with your insurance and call them and find out because many do reimburse for this, and it's about finding out the logistics of it. What do you reimburse? What do you need? What paperwork do you need? What codes do you need? Where do I send it? Like breaking down that barrier too, because again, if you can even be seen once or many times, like one, it's wonderful. So I think it could be helpful to talk about what we can do in a lactation visit. And you touch a little bit about what Nicole did, but when I go into a visit with a first time mom, first I just want to know how she wants to feed her baby, right? Because even as a lactation consultant, I can come in to support breastfeeding, pumping, bottle feeding, formula. It's feeding your baby. Like, how do you want to feed your baby? Maybe you want to breastfeed, maybe you want to stop breastfeeding, maybe you're looking to pump more so exclusively or wean some feedings down. Like there's so many pathways and a lactation consultant can do those pathways. I think step one is figuring out what does the mom want to do. And then a classic visit for me, I love these visits. They're just my favorite, is like, okay, you want to breastfeed. So I do, let's do it. I'm going to weigh your baby. We're going to do a feed. We're going to adjust the position. It's more than, yes, seeing the weight after a feed is so cool because you can see on our really like super savvy scale how much that baby transferred in their belly. But then it's also the scale's not there all the time and I'm not there all the time. So it's sort of like, let me show you like how do you feel your breast before a feed and can you hear your baby swallowing? Are they peeing? Like actually some real life skills of is this working? And then contrary to the hospital, I'm like, where's your pump? Do you have a pump? Get it out of the box. Let's take it out. Let's set it up. Let's size it. Let's make sure it fits. Let's make sure it's working. Let me show you how to use it. If a partner or a husband or a family member is there, I'm like, hey, you get over here. This is a bottle. This is how you would give a bottle. This is how you swaddle your baby if they're crying in the middle of the night. Like it does become sort of like a little pre-baby boot camp in the home with like your real baby.
Yes, it 100% does. Honestly, all of those things that you just went through we did with Nicole. And I did have my husband stop by the
Yeah,
nursery during a couple of her visits to say, this is how we position the bottle. We do it at like a level gradient. So they're
right.
not, drinking it too fast. And so there's, prevents spit up incidents and things of that nature so they can digest gradually. So yes, all of those things happened. It was amazing. And you're so right. There's so many different variations of feeding. We got to a great place where we decided, my breastfeeding would kind of be an appetizer course for Caroline. And then we were always going to supplement formula. And so our journey was I was going to comfort nurse as long as I could. And so I did that for 3 months. And then I always was doing a formula supplement pretty significantly on the end of the feed. So, was it time consuming? Yes, but I did want to do that as long as I possibly could. I learned how to use the pump well as well. That was another indication that didn't really have a great supply because I wasn't able to pump a lot of milk when I, learned how to use my pump appropriately. Because you're right, the
Right.
sizing is so key, and I think it's so helpful too to have Nicole or another LC come at different stages or different evolutions of as your baby grows, because the further out visit I had her come for, or even the phone call, was actually more of a discussion of, okay, we're at the 3 month mark now, how do I come down from this, how do I transition completely to formula
Right.
and completely to bottles. So the path you choose up front is going to change very much a couple months from then. So it was also very helpful to have that coaching at that stage.
Yeah, absolutely. I mean, as parents, like you just see everything's change day to day, week to week, and
Literally.
feeding journey changes. And what's really cool is feeding journeys change often, like for the better as you go along than for the worse, because you finally find your way. Like you finally find what feels right for you. And it does take that time. I think I'd love to talk a little bit about more, like you keep referencing, it's not just a nurse that came over, like that were Nicole and the nurses are able to help you like narrow that down. I feel like there's a lot out there, right? There's a lot of stuff on the internet and on social media of how to do it. And so I think I love that you're emphasizing that it is sort of this one-stop shop. And I do, how else outside of just feeding or even identifying that your supply was low, were you able to like utilize naps like for other topics outside of just that area so that you could stay in one place and not be going down like a rabbit hole on Google for other things?
Yes, yeah, absolutely. And nothing I think can be in lieu of an in-person visit. I could watch as many YouTube videos or videos till I'm blue in the face on like how to do the football hold, but I needed someone to place that baby and teach me how to do it and literally handhold me through it because I just did not have the coordination to figure out exactly how that was all going to work. And again, she gave me the confidence to say, yes, you can put your baby on their side and they can rest on this pillow. I wouldn't have thought you could actually do something like that. So the in-person visit is just so helpful. So I'm so grateful that I recognize, COVID was such a factor for a lot of moms as of
Right.
late. So I was very grateful to be able to have somebody come in home. And from that perspective, it was very safe. We both wore masks as well because we had a baby in February. But
Um,
yes, in terms of the, things I have used naps for, I think it's everything from the kind of emotional and network support. Having moms that are in your exact phase at the same time is just so hugely helpful. I'm so grateful that I have an amazing mom community in my best friend group as well. And so they have been a great sounding board for me. Where naps has come in though is having a group of moms that are in my exact same phase, and it is funny how quickly you forget what was happening at 3 months or what was happening at 4 months. And so just great to have a text chain with a group of moms that are all starting solids at the same time, are all maybe experiencing something about sleep at the same time. And it's just our group chat, Emily, from the new mom MSG is fire. We use it all the
love
time,
it.
and it's just so great. And I actually get excited when I see a text come through. I'm like, oh, what topic are we going to talk about today?
Oh,
So
just
it's so great
so
from
key to have the people, the moms in your life that have a baby
yes.
the same age as yours. I always tell
Y-
anyone who's pregnant, I'm like, find one friend that has a baby that's like due around you or the same age as your
Yes.
baby because it's so helpful when you're in real life in real time.
It's so critical. And I think the other, I can go on and on about this, but the other two things that I just have found truly invaluable in this experience for me are the like on demand questions I can ask on the Ask a Nurse board. You all respond with rapid fire. And I think what I always appreciate is you always give the mom a pat on the back for that they're doing great, you're doing it,
Yeah.
and you encourage us. But then you also give us, the feedback or advice we need. And it's just always so digestible. It's always so, in layman's terms, so matter of fact, like, okay, yes, I can do this. It's actionable. Let's go. And then you always ask like how it's going. Make sure to, get back to us. So I
Well,
appreciate
I
that
like a
so
pat on the
much.
back. Like someone the other day at
Yes.
work was like, you know what, Emily? Because all three of my kids were sick a couple
Ugh.
weeks ago, and it was really hard. It was hard to still work. It was hard to take care of them. My husband was away, and someone who works here at Naps was like, "I just want to give you a shout out. You did a really good job that week with like your kids and the baby, and that was really hard." And I was kind of like, "Thank you." Like it felt good to get a pat on the back because and have that
Yes.
acknowledgement because I'm a mom too, and I'm in it also. So I want that. I if I want to feel that way, I want to make other people feel that way too.
100%. Oh, the
Yeah,
positive reinforcement, the recognition,
I
it's
know.
something small you can do, but it means so much to
It
people,
is
I
so
think.
meaningful. I
Um,
appreciate that you notice that because it's so
yes.
important.
Yes,
Well,
absolutely. And then I love the video content as well. So I feel like as
oh,
I've, been through the different phases of
I
Caroline getting older, it's like, okay, I should, go through the 6 to 9 month modules now, or it is always something I can just like readily tap into. I always use like the infant bath video. When I got home, I was like, how am I gonna do this? Oh, great, I can watch this 4 minute infant bath video and know half of a sliver of what I'm doing.
Oh
So
my God. I feel
it's
like
just
people
so great.
listening at this point are like, wait, is this a Naps mom that Emily invited on, or is this an employee of Naps? Because you're just like
Oh
so
my God.
like
My
you're just
husband
saying
knows
the
like your
nicest things.
voices from Instagram story now. He literally is like, "Oh, I know who those people are." Like he can recognize it if I'm just like sitting listening to
Oh my gosh. All right.
it.
Well, I have one final question for you, and not to
Sure.
totally put you on the spot, but in the theme of like lactation and breastfeeding, specifically, because you have a lot of great advice to give moms because you're getting even further out now. But if you could look back to being pregnant or at that new mom breastfeeding, what is like one piece of advice you would give someone who is expecting a baby or like in the trenches with breastfeeding right now?
Yes, absolutely. To the extent that you can plan ahead and just look into your options so you know what you would have at your fingertips when you leave the hospital, I think is key. Lining up the insurance, seeing how you'd reach out, how you'd actually get that lactation consultant set up. Although you make it so easy for us to do that even if you were doing it in the 11th hour, you absolutely could get it set up. But try to look into it a little bit ahead of time. And when in doubt, book it. It's going to be so valuable and you're going to get so much out of it, even if you feel like breastfeeding is going swimmingly for you. I would say do it because it's going to be so valuable on so many levels if you just book it.
I like that advice. When in doubt, book it. It's like the slogan, just do it. Just do it. Just
That's
book it.
right. That's right.
Just book it. Even if everything's perfect and just going so smoothly, you're getting a pat on the back. And you're probably also going to walk away with some other really cool tips on sleep schedules, going back to work, anything that you want. So I think we could make couple
100%.
shirts. Just do it. Just book it. So,
Just book it.
all right, Alessandra, you're the best. Thank you so much for hanging out with me. You're just so
Thank you so
awesome.
much.
Thanks
Thank you
for
so much
loving
for
on
having
naps
me.
so much. And thanks to everyone who listened. I am going to link in the show notes just resources of our lactation page, a little bit more information on what we do at visits, how you can book a visit on our website, some common questions that we get around insurance and booking your visit, anything else that you might have questions for about that space, we will have that in the show notes for you. And thanks so much for everyone for listening, and thanks for coming on, Alessandra.
Thank you.
All
Bye.
right. I'll see you around town. Thanks, everyone.